Dr. Dan Yachter, the chiropractor. Happy Wednesday. This is a news, views, and weekly updates. And I've got very important information to share with you guys. I had a patient interaction this morning clinically, and it prompted me to share this info with you. And it has to do with the heart and the impact of exercise, just simple movement or movements that can dramatically impact your blood lipids, your cardiovascular health, your circulation, your weight, but really in general, just your heart health. How do you dramatically change your LDL, your triglycerides, your HDL? How do you move the needle on these things without drugs? How do you do it with lifestyle? We're going to talk about that during this segment. Last week, if you did not catch it, I ran through all of the blood markers that are pertinent, relevant to great heart health, strengthening your heart health, monitoring the health of your heart over the years. I went through all of that last week. And if you have a chance, go back through that if you missed it, and check it out. There's some vital information there. And next time you get a blood panel and you are concerned about your heart, make sure that those markers are there. You're tracking them year over year. So this segment is going to start off by focusing on, again, the impact that exercise can have, the dramatic impact that exercise can have on blood markers, specifically a few of concern: ApoB, LPA, the small dense particles of LDL that really most people are concerned about. So I'm going to jump into that, and then I'm going to close with sharing something inspiring. 102-year-old man climbing Mount Fuji. Really cool thing, very inspiring. So we're going to go into that as well. But I wanted to share with you vital information that we should all really be aware of. How walking, exercise, let's just use walking as the exercise focus here, and how it can transform your heart health, your blood lipids, and whatnot. So why movement matters. Let's park on this for just a little bit, and really why walking works as well, if not better, than just about any other form of exercise. The heart is a muscle designed for rhythm and resilience. When movement becomes consistent, daily consistency, the cardiovascular system can pump more efficiently. If that's the case, blood pressure comes down naturally, vessels stay more flexible, and pretty much every major health organization confirms that regular physical activity lowers heart disease risk and improves cholesterol patterns, not just in athletes, but in everyday adults. And really in any age. Walking stands out because it's sustainable, and it's easily, doable. Sustainable meaning that it's easy to stay with over time. So just doing exercise, okay, exclusive walking program, that's it. Reduce total cholesterol, LDL bad cholesterol, with some studies showing an average LDL drop of roughly 5 points or 5 milligrams per deciliter, improvements in total cholesterol to HDL ratios. You guys know I talk a lot about the ratios. So a significant improvement across the board: total cholesterol HDL ratio, LDL HDL ratio, triglyceride HDL ratio. These are small changes with just walking that can compound over months and years. So let's just talk about the lipid picture just a bit. What improves with exercise? Again, using walking as our yardstick here. HDL, aerobic exercise, is linked to an increase in HDL cholesterol and better HDL function, key for cholesterol transport and protecting your arteries from plaquing. It's plaque protection, plaquing formation or cumulative effect inside of the arteries. Higher workout volume and consistency tend to produce greater results and effects, of course, right? So the more you do it, the better it is. LDL bad cholesterol, ApoB, small dense LDL, SDLDL. These are the ones that we're always talking about. Regular aerobic activity, exercise, walking, including brisk walking, can lower LDL modestly And again, you pair it with nutrition and changing your body, losing some fat, you're going to do even better. Triglycerides, the one that you really want to watch on your blood lipid panel, movement helps. Again, when we say movement, just insert walking, brisk walking, 20 minutes of brisk walking every day. You could have the impact that I'm discussing right now. It helps reduce triglycerides, especially when the sessions are frequent and sustained, daily, ideally, and supporting metabolic and heart health. Again, even replacing sitting with more standing and walking time shifts your lipid profile in a favorable direction without medications. It's proof that every step counts. Every day, I track my steps with my Oura Ring. Over the last year, my daily count has averaged just beneath 9,000 steps per day. So having a tracking mechanism, a tracking app, a tracking technology, it's invaluable. So how much is enough? A simple target is 150 minutes per week of moderate activity, brisk walking, 75 minutes per week of vigorous movement, plus 2 days of strength training. Lifting weights is really important as well. That's 30 minutes a day, 5 days per week, walks before dinner, pace around if you have a home office, or at work if you can, if you're able to, pace and talk on your phone calls. Get up. You have a phone call, get up, move around, use every opportunity possible, any excuse possible to get up and move and get those minutes in, make it count, get the steps in. More movement brings more benefit. Okay, so again, there's so many ways you could put this together, but the message here is more movement, healthier heart, natural shifting in those markers that everybody's been taught to be concerned with. The ApoB, the small particles, the LDL, small particles that cause a problem. Your entire blood work, blood marker profile shifts favorably when you're moving your body regularly without pharmaceutical intervention. But most doctors will tell you if you bring this up during a consult with a medical doctor, they're going to tell you, no, yes, you want to exercise and move, but no, you need this drug if you're really going to impact and you're going to basically protect yourself from dying from these bad numbers. And that's just not true. If you employ powerful lifestyle strategies like we're talking about right now, you can naturally move these markers. And what I've seen clinically, at least as a clinician of 29 years, headed toward 30, is that lifestyle interventions, including many others that we talked about, not just walking, but many others that we talked about at our Heart Master class, have a much more powerful effect than any drug intervention can ever have without the negative, toxic, horrible side effects that many of these drugs create with long-term usage. So again, we never want to leave out the fact that if you are going for walks, you want to make sure that you're doing with great posture, eyes forward, shoulders back and relaxed, arms swinging naturally. If you're a patient of mine, you know what good posture looks like. You know what we always focus on in here. Breathing through the nose when possible to pace your effort and support recovery. Yes, breathing in and out of your nose, if you're a patient, not only shifts your heart rate variability to a favorable place, you have more parasympathetic effect. Your body's going to be more relaxed. It's a much healthier way of breathing, but it's also going to cause you to really hone in on your pace and your posture. But again, posture is critical. If you're like one of those people, like many times I'm driving down the road and I'm seeing these people jogging or walking, and it's painful for me to see this, but you see like people with their head down and they're doing this, either running or walking, or they're slouched over, they're hunched over, and it's awful because you're doing two horrible things to your health. One, mechanically you're diminishing the space for your heart and your lungs to beat and breathe properly. But secondly, and really more importantly, with your head forward, you're putting stress and strain on the spinal cord, the nerve roots. You're diminishing the communication. You're diminishing function, trying to travel from brain into heart, lungs, and glands, organs, blood vessels, your body in general. Just not a good idea. Focus on your posture while you're walking and trying to improve your cardiovascular function. So track what matters. It's not perfection, but keep track of your steps, keep track of your minutes, keep track of your resting heart rate. That's important because as you train, as you walk, as you get better condition, your heart rate drops, direct sign that your heart is getting stronger. Your lipid panel, try to get a lipid panel every 3 to 6 months, no longer than every 12 months. Look at your HDL. Exercise will help your HDL or good cholesterol go up. It'll ease your triglycerides down. It'll nudge your LDL down, but more importantly, your ApoB, which is the one you want to watch, easily controlled through movement. Combine movement with nourishing food, adequate protein intake, which I'll get to in another segment, not today, restorative sleep, bringing down cortisol, the stress hormone, improving heart function. Again, all this restorative sleep is great for biomarker shifting. Again, it's, the most important thing you want to do is, it's not about chasing numbers for their own sake. It's about building a healthier heart, that keeps up, that helps you keep up with life, your purpose, your children, your grandchildren, your dreams, your vision, what God has called you to do in life. So the message today, lace up, step out, and let the routine become, who you are and who your family is, and why, have a why behind what you're doing. Journey of 1,000 miles begins with the first step. And that's what I teach patients. Start somewhere. Walk out your door today, walk out your door tonight, and set a timer. If you're saying in your mind right now, I don't have the time to do this, I don't have the time to take a 20-minute stroll every day, you know what? Start with a minute. And I always bring that up with patients who are struggling to implement these healthy lifestyle habits or interventions. For example, we do spinal protocols, rehab. I do it, patients do it at home. We have one contraption called a Stoops strap, prolordotic, strap to enhance the curve in the neck. And I ask patients, are you doing it? Many times patients say, no, I don't have the time. And ideally, we want patients doing 20, 25, 30 of these a day, if not more. And patients say, I just don't have the time. I'm running out of time. I'm saying, you know what? Just do one, not 25 or 30 a day. Do one. That's all you have to do. And a lot of patients will look me in the eyes and say, what in the world is one going to do for me? If I have to do 25 or 50 of these a day, why are you telling me just to do one? I said, well, you'll see. It'll work. You'll be amazed. Just do one, next day do another. And as time goes on, you'll habituate that one, and you'll see how much easier it is to do more. And then you'll get into a rhythm, a cadence, a consistency. And before you know it, you'll build in this habit, and it'll be easy, and it'll just be seamlessly integrated into your life. Same thing with walking, same thing with beginning any kind of exercise program. And again, the reason is because it's important. It's important to your heart, and it's important to your health in general. So get to stepping, get it integrated, get it implemented. So of course, the last thing I'll leave you with is tomorrow is our big day, our big celebration day. We have our party here. If you have normally on Thursdays an appointment here before 11 o'clock, don't come before 11 o'clock. The party is between 11 and 6. It's a luau, Hawaiian theme. We'll have an active volcano in the middle of our office. You got to see this thing. It's quite impressive. It'll be spewing lava and smoke and all kinds of cool stuff. So bring your fire retardant Hawaiian costume, dress up, come join us. It's going to be a blast. We're going to have so much fun. It's to honor you, active patients. We want you here. This is a big day. We have food, fun. We have huge raffle giveaway prizes. You want to be part of this. And again, it's our way of honoring you. Then on Tuesday, the 14th of October from 11 to 1, you are allowed to refer in, if you're an active patient, only from patient referrals. You could refer in friends, family members, loved ones for free consults, exams, and report of findings way beyond $500 of services twice per year only. We do this for your friends and family and loved ones. And it's a way of giving back to you, but also more importantly, helping the community get access to vital life-saving services. So keep that in mind. It's going to be a blast. Tomorrow's going to be so much fun. Not only free food, fun, music, we're going to be dressed up. It's going to be a great party atmosphere. Come by, but free adjustments as well from 11 to 6. So join us if you want food. Deb Iguina, who's one of our patients, she has Deb's Delights. She's a baking extraordinaire, just an amazing baker, and she's going to bake us some cool stuff, make a big cake. It's going to be a lot of fun. So join us, put it on your calendar, even if you have just a short amount of time just to pop in, see the day and see the office. It's going to be a blast. So 11 to 6 tomorrow. And as always, I appreciate you joining me on these segments each Wednesday. This is Dr. Dan Yachter signing off for news, views, and weekly updates. God bless.